Explore Advocacy TV.
Puli MBBS ha India ne Shabar ri kum ha Russia, Uzbekistan, Georgia, China, Philippines bat kiwe de kiri. Kidi kitop medical colleges bat ru ha kador babiang.
Ka umdi basnyam bat penjasliang. Rupa Premium Meghalaya.
Ha ke Jingstad linti ke ban rupusnam ban besa yaki Umpohliew Jingstad syaki samla puli ka Synod College Shillong ha ka khadar tarik unaitung arjar arpsan kala pelong ya ka health camp ha ringkat ke Jingstad nok tilang bat ka National Health Mission lembat ka office District Medical and Health Officer kum shibenta ban pensuthu syaki samla puli bat syaki no Hikai ya ka Jing Koridor jong ka koit ka khia ka Junior Mission Director jong ka National Health Mission ka Dr. N.E. Karsano habakren hakane kisi kala penpau ba ka jing pelong ya kane ka health camp kan long ban pensung thu ya ka jing koridor jong ka koit ka khia kala batai ru ba ka jing pelong ya kum kini ki program ha ki shlem puli kan yarap bat a jing bentoi ru ya ki samla puli namar ba ka jing koit jing khia kan pelong ya ka jabieng ru bakan khampro hakani ka sila sakilang ru da ka District Medical and Health Officer ka Dr. Angel Kharduj ka Principal jong ka College ka Dr. G. Lingdo u Vice Principal u Dr. M. Rani u Head of Department of Political Science u Dr. C. R. Lingdo bat kisamla puli jong ka college.
Concerns afflicting them. Some of the common health challenges faced by our college youth are mental health disorders, substance abuse, non-communicable diseases, risky sexual behaviors which leads to unplanned pregnancy, sexual tract infections, HIV, and leading to a poor reproductive health. And also a big concern is anemia, which accounts for 50% of the cases in the girls, in the women in India. So these concerns, health issues, will be addressed by our Madam Director MCH Service, Dr. Karsano. And so all these health issues are the major cause of premature, untimely, and sudden death, which we are used to hearing nowadays in our neighborhood, amongst our relatives also. So all these can be prevented by promoting awareness on healthy lifestyle, on seeking professional help, example from counselors, from support groups, from doctors, nurses, and other professionals. So the main hurdle is that why our youth, they fear to come come forward for counseling. It's the fear of judgment and stigma. This fear is the biggest barrier to our youth to seek counseling professional help. And still, it's sad that internet is still the most accessible and primary source of information to our youth. But many a times, they are misinformed. The youth must rely on proper and authentic scientific knowledge and safeguard themselves from misinformation. Equip yourselves with knowledge from reliable source in order to be confident, assertive, to make right choices, and to build resilience in order so that you can cope in life.
I don't think anyone here is in any doubt about the importance of good health. We all know that health is wealth, and that good health is the foundation of a happy and a productive life. A healthy body is important for a sharp mind, and when students are healthy, they are better equipped to focus on their studies and leading to improved concentration and academic performances. Yet, how many of us follow the rules which will keep us healthy? How many of us can resist, especially as young adults, junk food? In this camp today, we have a dedicated team of doctors, nurses, and other health professionals from the NHM and also from the district, who will be offering free services such as general health checkup, dental and oral screening, eye checkup, and other basic checkup. And also we have counselors from the adolescent stall and mental health stall who will be there to help you, ready to listen to you, share information, answer your questions, and give you guidance on the various mental health concerns. They will teach you and guide you on how to cope with the stress and anxiety and improve your overall emotional well-being. This camp is also not just about providing screening services and medical care, but also about valuable health education and raising awareness about important health issues such as the non-communicable diseases like heart disease, lung disease, hypertension, diabetes, tuberculosis, cancer, and mental illness, and others. Non-communicable diseases are a major public health concern in India and also in our state, accounting for a significant portion of deaths. And they are on the rise in our state also. Unhealthy diet, lack of physical activity, tobacco and alcohol use are some of the risk factors contributing to the prevalence of NCDs. And we are also witnessing sudden deaths in young adults in the recent years, which are linked to all these NCDs. Most of these non-communicable diseases are preventable if you adopt healthy habits, avoid tobacco and alcohol use, and eating a healthy and balanced diet, practicing good hygiene, and regular exercises. Let us not also forget about the mental health, another growing concern, especially in the young adults, with a significant number experiencing conditions like depression, anxiety, and suicidal thoughts. Academic pressure, societal expectation, and impact of social media also contribute to the rise of in the mental health problems, especially among the young adults and students. Another issue that is a growing concern in our state is alcohol and substance abuse. People with addiction are at risk of associated health conditions like heart disease, lung disease, liver disease, physical and psychological dependence, poisoning and overdose, and even death. These affects not only mental and physical health, but also for students affect their academic progression. This camp today, the state government also has taken a serious health seriously, and they have set a goal and a target of achieving, of increasing the life expectancy of all citizens in the state, apart from reducing maternal and infant deaths. One of the main goal that we are trying to achieve is that to increase the life expectancy of all the citizens, and it is through this under the NCD program, by increasing awareness and screening for all individuals, especially above the 30 years age population. This camp today provides an opportunity for you to prioritize your health, to learn about healthy habits, and address any concerns that you have.
This camp is actually a part of our celebration of 60 years journey as a college. Yes, it is a celebration of our journey as a college through these 60 years, but I also want to remind us that programs such as these have always been a part and parcel of our activities and program in the college. 60 years ago, when this college was founded, it was founded on the objective of providing not only academic education, not only of providing academic excellence, but holistic growth and development of our student community, of our Synod College community. And as a part of that vision, throughout the years of our journey, these 60 years, we have always tried to incorporate programs which will reflect that holistic growth and development of our students as well as our staff and our faculty. So I believe that, yes, the commemoration in this 60th year journey is not something new. It is simply a reaffirmation of our commitment as a college to ensure the holistic growth and development of the college community, physically, mentally, emotionally, and also spiritually. The core values of our college, there are 4 core values in our college. One is faith in God. Number 2, it is moral uprightness. Number 3, it is quest for excellence. And number 4, it is social responsibility. So these are the 4 core values on which this college stands. And why am I saying this? I feel that a program such as this is meant not only to help students, to help the college community avail of the physical, the physical facilities which will be given today through this health camp. But after conversations yesterday along with the team who have come, the inspection team who have come from the health, from health, as well as this morning in my brief conversation with the respected DHS, we were talking. We said that in our state, one of the biggest barrier towards health is not so much, the non-availability of infrastructure or health, but actually it is the mindset, where people do not come forward to get the help that they need. And why am I saying this is because in our college, when we look at the demographic profile of our students, we almost a sizable population of our students here, they come from remote areas, and most of them are first generation learners. So the purpose of having a program such as this is not only to help you get the medical help that you need for yourselves, but we would like you, when you go back after this, to be the ambassadors to your own families, to your own neighborhood, to your own villages, that God has blessed us with with medical science, and they should not be afraid to come forward to get the help that they need. So I think if that message can be communicated to your communities, to your villages, to your families, I think part of this, of the objective of this program would have already been successful.
Hey, up, Ruko. Schwaba finchет da kajo shi kajo ko umpiang balapin don kam. Up schwa, namar kane kakta ya kakot kakya jong fi pat kamaryang rukum jo. Daka basyet da kane ka umpinyang kan tau bonjat ki jingpang. Henry pim day pat bante siya nala ne bantang pendono. Henry minta ka ruko ne ka repurpose use cooking oil scheme kala ban penkala ya kane ka umpinyang siya ka biodiesel. Tinamar kata limba ka ruko kakot kakya pat kamaryang rukan ktasyo.